Hello, welcome to Tools of the Trade live demo webinar. Today we're going to have the webinar Ultrasound Probes In-Depth, Use, Care, and Repair, eligible for 1 CE credit from the ACI. Presenter Jim Rickner, the Director of Service and Training at Advanced Ultrasound Systems, or AUS, will guide us through the comprehensive world of diagnostic ultrasound probes. He will begin with the fundamentals, explaining probe uses, types, and how frequency selection impacts imaging depth and resolution. Then he will detail specific ultrasound probes and their clinical applications. Importantly, the webinar will dedicate significant time to best practices for probe care, covering step-by-step cleaning and critical differences between low-level and high-level disinfection. Jim will also share vital safety procedures. In addition, be prepared to delve into the internal construction of probes, examining the membrane, case, cable, and connector. Next, Jim will provide practical guidance on common repair issues and the professional repair process, offering valuable insights to extend the operational life of your valuable equipment. This webinar is designed to enhance your technical knowledge and promote the safe, effective use of probes. Thank you to today's sponsor, Advanced Ultrasound Systems. AUS delivers fast, affordable, and expert support for all ultrasound brands. Founded in 2001, the company has established itself as a trusted leader in comprehensive ultrasound care, dedicated to maximizing system uptime and performance for all healthcare facilities nationwide. For more information, visit advancedultrasound.com. All right, now it's time for a trivia question. We're going to give away a multi-tool. January is National Blood Donor Month. What is the most common blood type? Please answer using the question feature in your dashboard, in your GoToWebinar dashboard. So what is the most common blood type? While y'all are doing that, I want to remind you to download the handouts available in the dashboard. There's some valuable information in there. All right, now stay tuned to find out who the winner is later in the webinar. I want to remind everyone also that today's presentation is eligible for 1 CE credit from the ACI. 1 hour after the end of today's broadcast, you will receive an emailed survey. Completing that survey will grant access to a certificate that you can download and print. We will wrap up today's webinar with a Q&A session. Please note that the webinar dashboard includes a questions feature where you can submit your questions for Jim at any time during the demo. If we don't have time to get to your question at the end of the webinar, AUS will send answers via email. So your question will be answered. All right, Jim, you may begin whenever you are ready.
Thanks, John. As you know, my name is Jim. I'm the Director of Service Training at Advanced Ultrasound. It's a real pleasure to be here today. Today we're going to talk about ultrasound probes. And for any of you who have worked on ultrasound, you know this is one of the high failure service items on ultrasound. This is due to various reasons. They're fragile in their very nature. Basically, crystal is a glass, so dropping them, handling them is, you have to be very careful with them. We're going to go through the makeup of probes today. We're going to talk about the different types of probes. We're going to talk about frequency in relationship to resolution. So we have a lot to cover today. I'm excited, and unfortunately or fortunately, if you have questions, please feel free to write them as we go. But we're going to answer the questions at the end of this session so that we can keep the flow going. So with that in mind, let's get started. The essential of ultrasound probes, and it's a clinician's viewpoint, is what we're trying to talk about. There's different names for probes. Probes are also known as transducers, and one of the Philips terminology is scan head. I just like to point out that we have different naming conventions for them because the sonographer will basically call them what they're most comfortable with. And it's sometimes confusing when the sonographer, for example, might say, hey, my scan head isn't giving me a good image quality. And you're confused as to what the scan head might be. Well, keep in mind, scan head, transducer, and probes all mean the same thing. And they're really the eyes and ears of the ultrasound system. There is what helps us find the objects in the human body. So we target a location in the human body, we transmit to that point, and then we get a reflection back from that. And that reflection allows us to map it to present a grayscale. So that grayscale then allows us to paint a picture, if you will, on the monitor, and based on the color, the different shades of gray, we can tell the density of the objects on the screen. So it's a really quite advanced now. It used to be that the grayscale was made up of only 12 different shades of gray, and now we're up to 256 different shades of gray, and we're able to see with a greater detail all the internal organs and structures in a body. All probes operate using the same fundamental principle, but the different shapes and sizes vary significantly. There are different frequencies, there's different uses, different clinical applications, if you will. But I like to use an easy analogy when we're talking probes. Probes is like the lens of a camera. You can be looking in the near field or the far field. You may require a wide angle. You may want to have the background be very clear as well as the foreground, so you can change what we call the aperture, if you will, or the focal zone in ultrasound terminology. So medical imaging professionals choose the correct probe to optimally visualize structures in the body. And this is critical, even if you're doing a preventative maintenance on the system. If you're checking a probe out, we need to check the probe out in the same environment, if you will, that the sonographer would be using the probe in. We don't want to use, as an example, a linear probe to do maybe a cardiac study, because they're never used in that manner. And we'll talk more about that throughout this presentation. But the whole point is choose the correct probe to get the correct image of the structure in the body you're looking at. To do this, we use what we call the piezoelectric effect. The piezoelectric effect is one of the unusual things that occur in nature. We discovered this back a long time ago with Madame Curie, and they discovered that quartz had an unusual characteristic, if you will. Quartz was able, if you hooked up a high voltage pulse to quartz, it vibrated and sent out a sound wave. And that was unusual by itself. But the other principle that happened was that if you had a pressure wave strike the quartz, it would cause the quartz material to generate a tiny electrical pulse. So this two ways of being able to interact with a quartz crystal allowed us to develop ultrasound, if you will. And we call that the direct effect and the indirect effect. The direct effect is basically when you have a pressure wave strike this quartz type material and it creates a tiny electrical pulse. We also associate that with the receive function in ultrasound. The indirect effect is basically when you take a high voltage pulse and deliver it to the crystal, causing it to send out a sound wave into the human body. And that is associated with the transmit pulse. So now we want to talk about the anatomy of an ultrasound probe. A lot of us don't understand what makes up a probe and how they basically function. And although we don't really need to know the in depth, it kind of helps us understand why they're easily damaged, and how important it is to get them repaired prior to major damage if you have that opportunity. We have the acoustic impedance matching layer, which is basically your acoustic lens. And if that lens is damaged in any way, peeling away, worn out because of cleaning or improper cleaning materials or solutions, you can cause holes in that lens material. And it's a coupler to the human body. It helps us reduce reflections coming back from the human body when we actually put it in contact with the skin. So if we lose this or have holes in it or patches missing, it definitely affects our image quality. It can also affect the fact that you might have potential electrical leakage into the patient, causing low-level shocks in some cases, which can feel like a pin poke, or that's a hair being pulled. That's most of the descriptions. So this acoustic layer, you want to do a good inspection on during a preventative maintenance or anytime you're in front of a system doing any kind of troubleshooting. So take a look at the probes, make sure they're safe. The backing material is a material that's used to reduce the continued vibration of the crystals themselves. We want them to vibrate, but we don't want them to continue to vibrate, so we dampen them. So when we hit the high voltage pulse, it sends out one pulse and doesn't continue to send out sound waves. So we have a backing layer, if you will, and it's critical to keep it from dampened, if you will, and it improves axial resolution. The array itself, we talked about, is made up of what, in the old days, quartz. Now it's normally a PZT or a lead zirconate titanate material that's man-made. And this material is much like glass. So if you drop the probe, it's easily damaged. So make sure that, you can't tell your sonographer so much, hey, don't drop these, because that's kind of obvious. But you can also point out the fact that these probes are very fragile by saying stuff that's not insulting, but educational, such as, this probe costs as much as my car. Most of the sonographers may not know that probes cost anywhere from $5,000 to $80,000. So trying to educate them without insulting them is a nice way to kind of reduce the damage that they're caused by improper handling. The housing and casing, it basically seals all the electronic components, the array, everything inside of a sealed case. This protects it from fluid damage or intrusion. It also keeps it electrically safe from an operator and patient's point of view. So make sure we're taking care of that in inspecting the case. The cable and strain relief, it's a micro coaxial wire bundle. And we're talking in a cable, in a traditional cable, you have 128 or 192 coax wires going through the bundle. And they're very fragile, and they're coax. So if you run over the cable, you bend it across a sharp surface, there's many ways you can damage these cables. So again, keeping them off the floor, keeping them from getting ran over, is really something important. Again, during the preventative maintenance, make sure you take your time and inspect the cable thoroughly and look for damage to it, so we can prevent further damage. This can cause image artifacts if the cabling inside is damaged. So do a good inspection on this as well. I added gel. It's not part of the probe, but it is a coupler. It couples the probe to the patient. And without it, if you just put a probe on the patient, will you get an image? Yes, but it's going to be drastically reduced in image quality. So make sure that you're using gel, whether you're using a phantom. You can also use water. If you're using a phantom, it's a very effective coupler. But you have to have a coupler to get the signal from the probe into the patient or into your imaging phantom to get the best image quality. Frequency is an important quality in ultrasound, and the frequency is directly proportional. If you see right below it says low frequency equals high penetration, but it also results in low resolution. So it's important for us to understand how frequency interacts with our image quality. We'll be able to see deeper into a patient with a low frequency probe, but our image quality is going to be reduced. The opposite's true. If you have a high frequency probe, you won't be able to penetrate very deep into the patient, but your image quality is going to be much better. So it's always a trade-off in ultrasound, trying to get the exact correct probe and frequency to give you the best image quality, but make sure you have enough penetration to get to the objects or structures that you're looking for. There are a variety of probes. We're going to go over each one of them. And I like to point out, some people say, well, why do I need, if I'm just trying to fix a machine, why do I need to know about the different types of probes? And I like to share a story. A long time ago, I'd say 10 years ago, I was a manager, and I had an engineer went out on an image quality problem on a cardiac machine, and they got to the customer site, and the director took them to the machine, said, this is a machine I'm having image quality issues with. And my engineer took a probe and stuck it on his carotid artery and started scanning with it. And the director threw him out, said, get out of here. You don't know what you're doing. And I got a phone call saying, I don't want somebody in here that does not know what they're doing. They took this probe, the wrong type of probe, and tried to image their carotid artery, and it wasn't even for that. So the customer, the radiology department, understood that the probe was supposed to be for the cardiac, for a heart study, and my engineer was using it for a carotid study. And they didn't want that. They wanted to have somebody that was knowledgeable about how the probes work. So it's really in your best interest to kind of understand how each probe works and what the function and what the clinical application for those types of probes are. So we're going to go through those now one at a time and kind of give you an idea of what's going on with them and try to help your understanding of them. We're going to start with the linear probe. You can see the image on the right. It's a rectangular probe, fairly wide. And underneath where it says linear array, you have the shape of the image that will be displayed on your monitor. So it's a flat footprint, meaning it's not going to be curved in any way. It produces a rectangular image, and the image represents the width of the probe. It's never any more or any less than the width of the probe. So keep that in mind. Even though the shape of the image may change as you zoom in or go deeper, the actual rectangle shape may change, but it's still representing the width of the probe. So please keep that in mind as you're looking at your monitor. The linear probe uses high frequency for excellent resolution. It's also used for superficial structures like blood vessels, thyroid, musculoskeletal. I mentioned thyroid breast imaging, Testicular, so some of that's called small parts. So all of these have one thing in common, that they're fairly surface oriented, which allows us to use the higher frequency. And frequencies in ultrasound go from 1 megahertz to 20 megahertz. That's traditional ultrasound. Okay, 1 megahertz being the lowest frequency, 20 being the highest. Okay, and I like to point that out. When we're talking linear probes, most of the linear probes stay in the 7 megahertz to 18 megahertz range. Okay, so 7 to 18 is a fairly common frequency range for linear probes. There are those that go outside of that, but those are the most common. Okay. Again, we talked about vascular, musculoskeletal, superficial imaging, thyroid and breast. So keep those in mind when you're looking at if you go into a clinic and you're looking at a linear probe. Those are your applications. If you're testing it, those are the applications you should be using to test a linear probe, so you get the best results. Then we have the curved linear or convex array probes. It's a curved footprint, gives you a wide angle. You can see it's kind of a pie-shaped image on the right. It's a wide angle field of view, as I mentioned. It's a lower frequency normally, designed for deeper penetration, and its primary application is abdominal or OBGYN. So keep that in mind when we talk low frequency. You're talking 2 to 5, 1 to 5 megahertz in that range. Philips, as an example, has one that goes from 2 megahertz to 9 megahertz. But they stay traditionally in the lower frequency for more penetration, which does, in general, reduce the image quality. Then we come to the phased array probe. It does have the pie-shaped or triangular footprint. They're also called sector probes or vector probes. These are for cardiac structures normally, some used for transcranial. They're also used in interventional or ultrasound, basically. They have a very narrow beam form, as you can see at the top, which gets wider angle as it goes into the body. And the reason we do this is for cardiac scanning, as an example, we have to scan between ribs, and ribs cause a real problem when we're trying to get past them for image. So we actually scan between them and go wider angle as we get more penetration. Then we have some specialized probes. We have an example here of what we call an invasive probe, endocavity, transvaginal, transrectal, transesophageal. So there's a variety of specialized probes that you can use. Some of them are 3D, 4D, which we'll talk more about here in a little while. But they offer internal imaging, so you actually enter the body, so you get closer to the organs and you bypass some of the superficial tissue that allows us to get improved image quality. So again, I've mentioned we have the endocavity or endovaginal. The shape, it's wand-like, designed for insertion, and examples are female pelvic exams or prostate exams for better internal views. So some examples of some specialized probes. Okay, we have the TEE probe, which is also an invasive probe, transesophageal echocardiography probe. It's for cardiac imaging. It has a flexible insertion tube. It's about the size of a finger, goes down the esophagus, and what it's designed to do is give you a detailed image of the heart. It avoids the ribs, the lungs, and gives you a better overall image quality. It has a control housing, which you can see with the two handles on it that allow you to move the tip left and right or up and down, so they can actually change the view while it's inside the esophagus and give them the best view of your heart. Has buttons to adjust the angle of the ultrasound. Modern TE probes use advanced technology for 3D and 4D imaging. These are very advanced probes. And the probes, if you ever have to work on them, you have to be very careful with them, very delicate with them. They are a high cost probe. Repair is normally around $18,000 as an example. New costs vary. They can go up to almost $80,000 new. So keep in mind, if you don't know how to use these, please give us a call, pass on. We're the experts. We can help you out with care and handling techniques, but they're fairly specialized probes, and you don't run into them a lot, but if you do and you don't know how to handle them, please give us a call and we'll help you out and help you through it. We also have what we call a non-imaging probe or pencil probe, PDOF probe. Some people call them OX-CW probes, which is continuous wave. It's a Doppler probe, has no images associated with it. It's only got two crystals in it. Now, one crystal continuously transmit, the other crystal continuously receives, excuse me, and hence the name continuous wave. Okay, this does not allow us to produce an image, but it does allow us to measure blood flow very accurately at high speeds. So it's a fairly specialized probe, normally used in cardiac environments, but some non-cardiac systems can use it if you buy an option, or if it's what they call a shared service system. So PDOF probes. And as I said, we have the 3D, 4D probes. There are some probes out there. You can see a picture of the X5-1 as an example, which is an advanced transducer that does 3D, 4D electronically using a matrix array. The bottom picture on the right shows a mechanical 3D, 4D probe, which is just a 2D probe basically on a motor inside of fluid that will allow the scan head to move back and forth and take many hundreds of 2D images, splice them together, stitch them together, and create a 3D, 4D image. It's called rendering. The mechanical 3D, 4D probes were the original ones designed. They do have oil inside of the dome, and if they start leaking, you may get some image artifacts that look like they're air bubbles, so it looks like a dark spot or a dropout on your lens. And it's important for you to understand that what you're probably doing is losing fluid or oil out of the inside of the probe, and that needs to be removed from service and repaired, or replaced if it's non-repairable. But the sooner you catch that, the better it is from a patient standpoint, from a diagnostic standpoint, as well as potential further damage to the probe. So early detection of that is critical. And we have a poll question.
Yes, we do, Jim, and that poll question is coming up now for people to answer. What is the most frequent type of probe issue you encounter in your clinical practice? Please select one of the following. Physical damage, such as cracks or cable damage. Performance issues, such as artifacts, dropouts, and noise. Disinfection or reprocessing failures. And then the fourth option is connector or recognition errors. So if you'll please vote in our poll question now. Getting some answers coming in, and it looks like everyone has participated now, and 71% say physical damage, Jim, followed by 19% saying performance, 6% saying disinfection, and 3% saying connector or recognition errors. So physical damage is by far, over 70% answered physical damage.
All right, thank you, John. Physical damage is probably one of the most common of the four that we mentioned there. We run across that very often. And it's not surprising when the probe is what the sonographer handles every day, every patient, and accidents happen. I hate to tell on myself, but when I was a brand new engineer many years ago, my service manager was out with me. I was doing my first PM, and the very first thing I did was try to image quality test a probe, and it hung up on the caster, the down by the wheel, and it pulled the probe right out of my hand, and I dropped the probe. And that was, day one basically of me doing a PM out in the field. And it's just easy to do, and that's the message. You have to be very conscious when you're holding these probes, because you can cause physical damage to them fairly easy. So thanks for your input, and we'll continue on. Care and maintenance of probes. You have to handle them with care. That was the message that we just got from the poll question. Avoid dropping, bumping, twisting the cable excessively. Many of the things that we see happen all the time. We come into a room and the cabling is all twisted up because they never take the time to uncurl it, and it gets wound around other probe cables. It's best just to keep them as organized as you can, and definitely off the floor, so that they don't run over the cables. GE, as an example, has a cable holding system that works very well and very convenient. We just have to get kind of the sonographers and ourselves used to using it. So, I'll be walking down or doing preventative maintenance or troubleshooting on a system, and I'll notice that several ultrasounds will have the cabling on the ground, and it's just hard for me. I go over and I clean up the cables and I get it off the ground, and try to educate the sonographers how important it is, because it costs a lot of money. When they are not on the system, store them in designated holders and cases. And you don't want them out in sunshine. You don't want to leave them in your trunk if you're transporting them in super hot weather, direct sunlight. So just some things to talk about or think about when we're handling probes. Cleaning and disinfection. This is a difficult one. Manufacturers have guidelines. And your facilities have protocols that you need to really look at and understand, and you have to conform with them. And it varies from facility to facility, so you just have to familiarize yourself with your facility's procedures, but you also have to look at the manufacturer's guideline and make sure you're not using chemicals or solutions that are harmful to the probe. And if they are, then as an organization, you have to look at how to change it and yet still protect the patient and yourself from infections and so on. So use approved cleaning agents and high-level disinfectants and appropriate for the probe type, meaning, again, each manufacturer has a chart, has guidelines to what disinfectants should be used or should not be used. Some need to be sterilized, others don't. You just need to know all these things when you're talking about probes. TEE probes, for example, absolutely need to be high level sterilized, stored in HIPAA cabinets that protect them from contamination while they're not in use. So you have some guidelines. Make sure that you're complying with all the hospital facilities guidelines. You should absolutely wipe them clean immediately after use. You want to remove any gel debris. This is really the sonographer's job, but it's also your job to make sure it's happening, especially if they're accredited through, let's say, American College of Radiology. If they're ACR accredited, one of the things that happens is an inspector comes in and sees gel on a probe while the sonographer is not in the room, and that's considered a patient safety issue, and that can lose their accreditation. So keeping your eyes open for these types of environments are important. You should avoid harsh chemicals when they're not needed. Alcohol, unless it's approved for that type of probe. Submerging the connector. People say, well, that never happens. Well, that's not true. I was at a hospital and one of the surgical nurses was told to go ahead and sanitize the probe, and she put the whole probe in the solution. It does happen. Just keep in mind, know what the levels that you're supposed to, what parts of the probe you should be able to submerge and which ones you should just clean manually. But you should never have the probe submerged in any liquid, the connector, excuse me. Risks and infection control for invasive probes. This is your endocavity probes we talked about earlier. There are high contamination risk, frequently harbor bacteria, viruses in blood, even after low level disinfection. And when you see that, you need to make sure you're taking the proper care of those. There are some new techniques out there. They have I can't think, I just lost the name of it. It'll come back to me. Just give me a second. But you want to make sure that you're going out of your way. The trophon, I'm sorry, that's the word I was looking for. You want to take the extra time, the extra steps to do this high level decontamination. Serious infections can occur if you don't do it correctly. So including hepatitis B. So, it's in our best interest to make sure we're following all your guidelines. Sterilization techniques require full sterile barriers for procedures where probe contacts sterile tissue or broken skin. So there's covers, there's different barriers that they can put around the probe prior to having it be inserted inside the human body. So again, following proper techniques is important. Demands high level disinfection or sterilization. This is normally done by sterile processing in a hospital for TEE probes as an example, or the trophon system for endocavity probes. So keep in mind, make sure you're following your hospital's guidelines because you can cause patient harm. Physical inspection is critical, not only during preventative maintenance, but anytime you're in front of a system, take a couple minutes to take a look at the probes and make sure that they're safe and that their image quality is working in accordance with manufacturer specifications. Regularly check the lens for cracks, punctures, swelling, inspect the cables, rips, cuts, fraying. Check the connectors for bent pins or shock or burnt pins. Make sure that everything looks and feels normal, that there's no cracks in the casing. If you find damage, take them out of service, remove them from service. There are many programs out there. We offer, as an example, a free loaner if we have that make and model in stock as a loaner. We can send you a loaner probe. You take yours out of service. We offer free evaluation, and you send it to us. We evaluate the damage to the probe. We give you a quote, and all this is free until you approve the fact, what is the nature of the repair, which we give you up front. So please do a good physical inspection of all your probes. Make sure that they're patient safe, electrically safe, and that they will provide accurate clinical diagnostic imaging. We have another poll question, John.
I see that right here. So when you suspect a probe is malfunctioning, what is your team's most typical first action? Select one of the following. Use it until it completely fails. Immediately send it for service repair. Perform in-house troubleshooting, cleaning, reseating, connection. Or set it aside and use a backup probe. We have some answers coming in right now, and the final results are in, and 67% said they do or they perform in-house troubleshooting before they do anything else, followed at 19% by immediately send it for service repair. So almost 70% perform in-house troubleshooting first, Jim.
Thank you, John. And that's really probably a really good way to go. If you're familiar with ultrasound, in-house testing is by far the easiest. One of the things that we teach in our classes is multiple ports and multiple probes. And what that means is if your probe's not working in one port, try moving it to another port on the system. If you have a full-size system with multiple ports, try using it in a different port and see if the image quality changes. It could be a port problem. If the image quality stays the same in multiple ports, try moving it to a different system and see if the image quality issue follows the probe, or take a probe from a different system and put it on the one and compare the two probes. Does one have the issue and the other doesn't? That clearly points to a probe issue, which should result in it being sent out for repair evaluation. So we teach multiple probes and multiple ports as a really simple troubleshooting technique that doesn't require any screwdriver or anything. So anytime you may have an issue with that, please give us a call. We'll help you through it. We'll be happy to do that. So thank you. TEE probes. Again, I mentioned that these are very high cost probes, and the care and handling of these, they're very sensitive. So again, if you haven't had training and don't know how to use them or care for them or handle them, please reach out to us. We'll help you out. We'll tell you do's and don'ts, and we'll try to guide you through the process. But you need to absolutely follow a strict multi-step process. You have to clean them immediately after with enzymatic cleaners. You have to rinse that thoroughly. You can't leave that on the probe. It causes degradation. And then you have to perform high-level disinfection using the FDA-approved liquid agents. We've listed some there. There are automated systems out there that you can use. The hospital can purchase, and they do it all for you. And then you store them in the HIPAA cabinets hanging, and allow it to stay sterile. And the process for that is they have to be re-sterilized every 72 hours, even if they're stored in a HIPAA cabinet. So keep it in mind. These are very high-level disinfection type devices. They're sensitive. They're expensive. So again, knowing how to handle them is critical. I'd like to talk about some common failures that require repair. We run across these fairly often, and I just like to point them out. Some of them are overlooked. Some of them the sonographer says, "Oh, I don't worry about that. It doesn't affect my field of view. It's off to the edge of the image," and I just like to point them out so we can talk about them. Any damage to the acoustic lens or membrane, you should immediately remove that probe from service and get it repaired or replaced. Again, we offer loaner probes, so you shouldn't be without a probe. But it allows gel or fluid to be intrusive, get inside to cause more damage to the backing material, to the electronics. And it can also allow electrical shock to reach the patient. So electrical safety is compromised, image quality is compromised, and it can leak fluid into the probe. So as soon as you see damage to the lens, you should take it out of service and get it repaired or replaced, which will reduce the cost of the repair because you've got it out of service before extensive damage has occurred. Cable and strain relief, it's very common. You have a picture there on the right, shows you where the cable has come loose from the strain relief, and you have your cable just wide open and broke. You can cause damage to each one of the individual coax cables. Yanking on the cable can cause this. As soon as you see this happen, again, we can repair this without significant cost, nowhere near the cost of the probe, if you catch it early. If you wait till the cable is damaged, the cost of repair goes way up. The connector. Connectors can cause a variety of problems. You can have burnt pins, you can have bent pins, you can plug in a probe and have it kick an error message saying it's unrecognized by the system, or it just won't ID. Connector problems can be caused by dropping the connector, which may cause it to not ID. Again, if you're troubleshooting connector problems, try it in multiple ports. Try it on a different system if there's one available. And if it continues to give problems in multiple ports and multiple systems, then it's time to take it out of service and get it repaired or replaced. Crystal or element failure. You can see the image on the right. There's a dark spot in the middle of the image. This is caused by maybe dropping the probe. Could be because the cable got ran over. There's lots of reasons this can be caused. It may be probe related, may be system related. Again, multiple probes and multiple ports will help you analyze whether it's system or probe related. You have to once you determine that if it is probe related, then it's really in your best interest to get it sent in for evaluation. A lot of the sonographers may tell you if it's off, this one's directly in the center, but if the artifact is off to the left of the edge or the edge of the image, it's not important to them. But the reality is it can cause other problems with Doppler readings. It can cause image quality and misdiagnosis. So it's in your best interest, if you have dropouts, whether they're in the middle or the edges of the system, to go ahead and get it evaluated for repair. And John, another poll question. John, are you there?
Hey, Jim, I'm here.
There you go.
Sorry about that. I dropped out for just a second. The poll question's up. It says, if you encounter image artifacts or performance issues, Which step do you find most effective to try first? Select one of the following. Thoroughly clean and disinfect the probe. Check all cable connections and strain relief. Visually inspect the lens and housing for damage. Or do you try the probe on a different ultrasound machine? So we have answers coming in, and the final results are up. 42% said they visually inspect the lens and housing for damage, followed by 24% try the probe on a different ultrasound machine.
Excellent. Yeah, and those are both very good answers. To me, the very first thing I'm going to do is look at the lens to see if I can see physical damage. But then once if I can, or if I can see physical damage, then it's pretty clear what the issue is. If I can't, which is not uncommon, then moving it to a different system is an excellent way of either confirming or one way or the other. You can confirm that it is the probe, or you can confirm that it's not and the system is causing the issue. So inspecting the lens and then moving it to another system is really great troubleshooting technique. Thank you, John. So we're moving on to our last section. It's continuing on with some common failures. Cracked housing, seams. You can see the picture on the right has a cracked housing. This can cause a lot of issues. Clearly, you're using gel when you couple to the patient. If you're using it on a preventative maintenance, you may be using water with a saline solution that can leak into the internal components. Either way, what you're asking for is problems. If you have a probe with a cracked housing or a seam that's not completely sealed, you should remove that probe from service. This can also create a hazard from an electrical safety standpoint. So all of this needs to be taken into effect, and this probe needs to be removed from service and repaired or replaced. Fluid invasion, we're showing you the tip of a TEE probe, and you can see that there's the bending rubber, and you can see there's, I don't know if that's a bite mark, I don't know what the nick, I don't know how it was caused, but if there's a hole in there and the fluid gets inside of it, it causes quickly causes severe damage, and over time just gets worse and worse, driving up the cost of repair. So as soon as you see anything like the damage that we're showing in the picture, it's in your best interest to get that probe removed from service and evaluated. So again, the sooner the detection, the better it is. When you look at it, the picture, we have some circled areas in red. You can also see that there's some separation there. This is going to cause fluid intrusion as well, and you want to be aware of that. So I just wanted to show you some ideas, some things to look for while you're inspecting a TEE probe. Again, the sooner you recognize it and get it out of service and evaluated, the better it is for you. Physical inspection. If you do a physical inspection every time you're in front of an ultrasound system, the physical inspection is a very quick way to evaluate a probe. So if there's visible damage or the probe is malfunctioning, it should be repaired immediately. And again, the sooner you detect it, the better it is, to lower the cost. If you wait, it's just going to drive up the cost. There's going to be more damage to the probe, or it may become unrepairable. So regular maintenance checks are critical for ultrasound probes. And if you have questions, it says, if you suspect any problems, it's essential to consult a qualified technician. If you have questions, call us. We're here to help. That's our job. We have 24/7 tech support, so please don't hesitate to call. How are probes assessed? Well, there's several ways, but one of the ways we use is a ultrasound probe testing equipment, and it can tell us whether many things. It can tell us whether it's a cable break. It can tell us if the element's weak, if the element's not working at all. It can tell us delamination. These probe tests allow us to do a lot of things. And the way we do it, we get a probe in, we make sure it's disinfected, we do a visual inspection, we perform electrical leakage testing on it, and then we do ultrasound performance testing, meaning we hook it up to a system, and then ultimately we put it on a probe tester. And you can see from this, most of what we do is exactly what you should do in the field. Make sure the probe's clean, do a visual inspection, electrical safety test it, and then do image quality testing. That's what you do in the field. We do the same thing in-house when we receive a probe, and the only thing we do differently after that is we have probe testing equipment to go a step further to guide us in what actually needs to be repaired on a probe. What makes your probe unrepairable? Well, several things. We talked about severe physical damage, cracked casings, broken cables, just broken strain reliefs, extensive fraying. I mean, there's a lot of things that can cause it to be unrepairable. Some of it we can repair. For example, some probes we can completely replace the probe cabling if it's a cable problem. Other probes are hardwired, meaning they're all soldered on and the cable can't be replaced. Internal component failure. Some of the probes have internal components on them that get damaged, and they're potted, which means that they have a resin over the top of them that keeps us from getting to the components and repairing them or replacing them. So the fact that they're potted makes them unrepairable, even though without that potting material, we would be able to repair them. So some of the probes are just unrepairable by the way they're manufactured. Water or liquid damage can cause severe problems with the probe. Inability to meet imaging standards can point directly towards an array. And if the array is damaged, that's not repairable. We have to get a completely new array, which means that's the cost of a brand new probe. So they're not considered repairable. And we may have a probe that is so high in its cost to repair that it's better just to go ahead and purchase a replacement. So some of them may be considered repairable, but when you look at the cost of what it would cost to repair it, it's just better in general to go ahead and replace the probe. And that's really the what we wanted to cover today. So I'd like to open it up for question and answers.
Fantastic, Jim. We did have some questions come in. We're running a little short on time. One question we had is, can we have a copy of this presentation for future reference guide? And I believe AUS will be sending out a copy to all of the attendees within the next couple of days.
That's correct.
So that's an easy one to answer. And we will send the rest of the questions to AUS and they can answer them via email. It's we're at 2 o'clock right now, so we have to wrap it up. That was a lot of great information, Jim. Thank you so much for sharing your knowledge with the TechNation community. The winner of today's multi-tool for correctly answering the trivia question is Josh Moffitt in Kansas. The correct answer is O positive. Now, a quick reminder that you can obtain your CE certificate by completing the post-webinar survey. The survey will be emailed in 1 hour. You must complete the survey to receive your 1 CE credit from the ACI. You will be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach out to us through email at webinar@mdpublishing.com. Thank you for your attention today, Jim. Thank you for a great presentation, and everyone have a wonderful day.
Thank you. Thanks, everyone.